What new problems are your referral sources facing right now that they may not have had last week? And how are you uniquely qualified to help them? Now, we ask this question consistently with our teams, and now more than ever, this is the question to ask. In this specific case, we are talking about patient screenings. So if you're an in-home care provider, what does this mean to you? You're the one you're not doing the screenings. So how do you turn this into a marketing opportunity? And this is what Cheryl and I have been sharing with our in-home care teams. Your favorite home health has to do these screening calls. And in some case, it's the clinical team or the office team, or on a few of our teams, the marketers are actually doing it. But are they asking additional questions? You saw her ask them about, do they have signs and symptoms? But are they asking about ADLs, shopping, meal prep, light housekeeping? Maybe. You don't know until you ask. We have taught a partnership strategy for a number of years. In fact, for in-home care, we taught this at the first NPDA conference in San Diego over 12 years ago. Get a home health provider as your partner. Many home healths do not have an in-home care arm, or if they do, at least they may not do in-home care the way you do in-home care. So the question is during this screening process, are your partner home health asking questions about ADLs, shopping, groceries, social determinants of health? Do the patients need extra help? Your in-home care could be the appropriate and perfect answer. Now, the next question always comes is, what about hospice? Well, of course, it's the same idea, just tweaked for hospice. So are you working with a home health to help them identify if any of their patients should be transitioning to hospice? Now is the perfect time. We hear many agencies on the message boards talk about not having enough clinical staff due to quarantine and trying to shift visits to make sure everyone is covered. Now is the perfect time to make sure all the patients are on the appropriate level of service, and it might be the perfect time to transition to hospice.